Health Quarter 3, Module 3A. The 21st century has brought about a shared responsibility for public health protection. It is important for people to understand global issues such as fair access to healthcare and protection against malnutrition threats that affect billions of people worldwide. This module focuses on the significance of global health initiatives and aims to educate individuals on the various issues and initiatives made to address them. According to the United Nations Millennium Declaration, signed in September 2000, commits world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. As stated by the United Nations, WHO Access on December 2021. Key facts. Globally, the number of deaths of children under 5 years of age fell from 12.7 million in 1990 to 6.3 million in 2013. In developing countries, the percentage of underweight children under 5 years. Globally, new HIV infections declined by 38% between 2001 and 2013. Existing cases of tuberculosis are declining, along with deaths among HIV-negative tuberculosis cases. In 2010, the world met the United Nations Millennium Development Goals. Target on access to safe drinking water, as measured by the proxy indicator of access to improved drinking water sources, but more needs to be done to achieve the sanitation target. The United Nations Millennium Development Goals MDGs are 8 objectives agreed upon by UN member states to be achieved by 2015. These goals were derived from the United Nations Millennium Declaration, which was signed in September 2000 and committed world leaders to fight poverty, hunger, disease, ignorance, environmental degradation, and oppression of women. Each MDG has specific targets set for 2015 and indicators to monitor progress from 1990 levels. Some of these goals directly relate to health. 1. Eradicate extreme poverty and hunger. Agricultural nations, especially in Africa and Asia, experience the ill effects of outrageous neediness and yearning. Destitution and yearning prompt serious lack of healthy sustenance, which prompts deep-rooted physical and intellectual learning and thinking, harm and influences well-being, prosperity and the economy. A few critical ideas to destroy neediness and yearning are instruction, advancing sex correspondence, creating more positions, putting more in agribusiness, reinforce sustenance programs for youngsters and babies, backing and security of creating and weak nations during emergencies. 2. Achieve universal primary education. DPED's essential objective to guarantee progression of education for all made. Effect across the country, benefiting the people who can bear the cost of training. However, generally the individuals who are less lucky with incredible dreams to succeed. In help with this reason, the public authority gave free instruction in all states. Funded schools in the Philippines. In this manner, making higher percent of graduates, finishing their essential, auxiliary, and tertiary instruction. 4. Reduce child mortality. Projects and arrangements which assist with lessening kid mortality, like working on dietary admission, medical care offices and framework, and different fields, which further develop youngsters' lives. Reinforcing neighborhood and public well-being projects and arrangements is one method for diminishing kid mortality. 5. Improve maternal health. Further develop maternal well-being isn't just with regards to mothers. Well-being yet additionally includes the well-being and health of the family, maternal. Well-being additionally destroys different issues like destitution, sex disparity, diminished labor force, lower birth passings and handicap of ladies, improved and proper nutrition of mothers. Teaching the benefits of birth spacing and small family size. Educating young boys and girls about the importance of maternal health. Better and improved access to hospital care, especially obstetric gynecology, prenatal and postnatal care. 6. Combat HIV/AIDS, malaria, and other diseases. The emergence and recurrence of diseases such as HIV/AIDS, malaria, flu, and others have negative impacts on the productivity and growth of nations. These effects include job losses, shortage of skilled professionals, and social crises. Children are particularly vulnerable to these diseases and are exposed to exploitation and abuse that hinder their normal development. Effective prevention, treatment, and care are some ways to combat these illnesses. Improved housing conditions, increased access to anti-malarial medicines, promoting safer sex behavior and preventive education for all, promoting tuberculosis, TB screening of HIV/AIDS persons, and TB directly observed treatment, short TB DOTS course therapy, promoting the use of insecticide-treated nets to fight mosquito-borne diseases. 7. Ensure environmental sustainability, contributing and supporting maintainable energy like sun-based wind and water energy. Assist with supporting positions, set out business open doors, and safe. Staying non-environmentally friendly power sources, natural manageability, guarantees individuals to live better and partake in a perfect and green climate. A portion of the advantages of an economic climate are cleaner air and environment, clean, environment-friendly, and renewable energy, new and aspiring jobs and business in energy, increased access to sanitation. 8. Global Partnership for Development. The United Nations, World Health Organization, World Bank, and legislatures cooperate to ensure there is reasonable exchange in that intensely obliged nations. Get alleviation and assets to battle neediness, lack of healthy sustenance, and assets for instruction and social activities. A few advantages of worldwide association are expanded international trade agreements, improved access to affordable medicine, reduced poverty through government debt relief grant, developed information and communication technology IT infrastructure.